Hello and welcome everyone to our TUM Academy webinar series. TUM Academy started as Australia and New Zealand's first free professional development platform for interpreters and translators, but has since become also a principal stakeholder engagement platform for different industries, and today it's health services. So the TUM Academy is brought to you by TUM Language Services, one of Australia's leading translation interpreting service providers, also for the health sector. As we begin, I would like to acknowledge the traditional custodians of the Turrbal Jagera people and their connections to land, sea, community, and language, and pay my respects to their elders past, present, and emerging. And I also acknowledge the traditional custodians of the various lands on which each of you are living, learning, working today, and extend that respect to the Aboriginal and Torres Strait Island people participating in this webinar today. My name is Thea Dieterich. I'm the founder and CEO of TUM Language Services, and I will be your MC for today. I'm also a NATI certified interpreter myself. I chair the Australasian Association of Language Companies, and I also sit on the NATI Regional Advisory Council in Queensland. Just a couple of housekeeping items. We're making a recording of this presentation. Participants will be able to access this later on our TUM Academy website, and they will also be sent the link. And if you have any questions, please type them into your chat box at any time. You can use the chat box or the Q&A box, and we'll try to get through them in the Q&A sections at the end. But today's webinar is Health Services Meet Language Services. So it's dedicated to you. It's dedicated to the health services that are in the audience today. We have many of the Health Share Services Victoria participating agencies where TUM and many other language service providers are on the panel of the language service providers. But we also welcome health services from Western Australia, Tasmania, Queensland, South Australia, the Territories, and New South Wales. And it's you who we want to listen to. It's who we want to hear from. And when you say we, I say all of us. We've got hundreds of interpreters and translators in the audience, and also who will see this later. So we want to listen to your challenges, concerns, observations, and problems, and see if we can come up with solutions or at least tackle them. And this can only be done with the stakeholders. That's why we've got a panel who you will meet in a minute. It's very important that all of us, be it the interpreters, the health services, the standards body, the technology, the language service providers, and I, of course, warmly welcome all the language service providers in the audience as well. We don't talk about our agenda in silos, right? Bring them out. There's no need to be defensive either, right? But to look at them and see how can we, how can we tackle them together, raise awareness of the challenges, find a plan, and ultimately together achieve better outcomes. But enough about the floor. We've acknowledged the country, so over to our panel. So please, I'm going to go around and everybody introduces themselves, and I'm going to start with Yue.
Thank you, Tia. Hello, everyone. My name is Yue. Yue. My background is NATI certified Mandarin interpreter and Chinese translator. I have been working for Northern Health for 12 years, and my current role here is the acting director for Transcultural and Language Services Department, as well as Aboriginal Support Unit. So it is an honor and a privilege to be invited to participate in this webinar, and I am delighted to be here today. Thank you.
Fantastic. Thank you very much. Despina, over to you to introduce yourself.
Thank you very much, Thea, to you and the TUM language team for the invitation today. My name is Despina Manatidou. I'm a Greek interpreter and translator, and I'm employed full-time as an in-house interpreter at the Melbourne Hospital. When I don't interpret and or translate, I volunteer with the Australian Institute Interpreters and Translators, where I serve as the Vice President for Events and Professional Development. Thank you for having me.
Fantastic. Thank you very much. Over to you, Mark.
Thank you, Tia, and hello everyone. Thanks for having us. Hello to the rest of the panel, and most importantly, hello to all of those out there joining in. I'm Mark Painting, the Chief Executive Officer of NAATI. For those maybe not familiar, NAATI is the national certifying authority for the translating and interpreting sector in Australia.
Excellent. And we've got Linda, Drew, and by the way, for everyone, Despina, for example, when she speaks, she will just turn her video off because of internet reasons, but otherwise you can see her on. Linda, over to you to introduce yourself.
Hello everyone, my name is Linda. I'm the Barwon Health Language Services Coordinator. I've got a background in communications and public relations, and currently managing all the in-house and agency interpreter bookings, communications and training through Barwon Health.
Excellent, thank you. And Steve?
Oh, thank you. Thank you to everyone that's joined. Thank you for taking the time out this afternoon. We hope that you get a lot of benefit from this. My name is Steve Hooper. I'm the Chief Product Officer for IMS. It's an interpreter management system that's used widely across several hospitals across Australia, America, other companies around the world as well. So I'm here to talk about technology. Thank you.
Thank you. And Helena, over to you.
Thank you, Tia. Hello, everyone. Welcome to this wonderful webinar and amazing opportunity to listen to everyone's thoughts and see how we can help. My name is Helena Rojas, or Elena Rojas. I'm Head of Operations at 2M Language Services. My role at 2M is I oversee the operational activities at 2M and I lead our project management team. I also hire new members, train, and also look continuously at improving quality assurance processes. I work very closely with our customers and ensure that we always meet their needs and always looking at improvement. Thank you very much. Wonderful to be here.
Thank you, Helena. And we've got double bonus here. We also got Tamas, who's also with 2M. Over to Tamas to say quickly hello.
Good afternoon. Yes, my name is Tamas Nieste. I'm the head of interpreting. I'm not strictly a panelist, as you can see. I'm missing from that illustrious list, being lazily away for a week or so on annual leave. But of course, I'm here. I'll be watching the chat window and definitely want to be hearing from you if you're an interpreter and we haven't met before. So we'll be in touch after this meeting, that's for sure. Thanks to you.
Fantastic. And yeah, Tamas was on the panelist list. I just looked at these participants that are already online. At the moment, we have 250 online because we have a lot who will, but we got some illustrious characters. Adolfo Gentiles in there as well. Hello, Adolfo. And yeah, fantastic to see you all there. But over to you, please set the scene and you know, and just let me know when you want the next slide, please.
Wonderful. Thank you. Thank you, Tia. Thank you, everyone. So I'd like to start by introducing the department that I work with, which is TAOS, standing for Transcultural and Language Services Department at Northern Health. So TAOS was established in 2007 by our former director, Emiliano Zucchi, who is currently the CEO of Ethnic Communities Council of Victoria. 15 years ago, starting with only 4 staff members. Only over the past 15 years, we have grown from 4 to more than 40 staff, covering close to 80% of our in-house interpreting services in-house in more than 20 languages. So we receive over 60,000 interpreting bookings per annum, on average about 300 bookings a day. Besides interpreting service, we also provide translation service on our top 8 languages, mainly for patient brochures and information sheets. In fact, we also take a little bit further, we take a step further to co-design our patient brochures with our health literacy staff, as well as our community consumers, to make sure the literature we are producing are culturally appropriate and reasonable to translate. Another big area for TAOS is to provide transcultural training for Northern Health staff, covering the basic principles of working with language services professionals and its benefits of making the organization culturally competent. So we have been providing this training across the organization in the last 15 years, and it has shifted the model of care to our CALD community, and we're very glad to see that. We also provide education to interpreting students at Monash University as well as RMIT by giving lectures to them. Also, we invite them to attend our student practicum program where they would have an experience in a real healthcare setting about how interpreting in real life looks like. So TAOS is also very research active. We have published over 30 national and international conference papers and articles in providing the evidence of its positive impact on health outcomes when engaging language service as part of the healthcare. So at Northern Health, we also have a policy. In our research policy, we state 25% of the participants in any clinical research need to come from a CALD background. So because it will truly reflect the Australian demographic if we incorporate that 25% of the participants in the CALD community. And our language service professionals, of course, are also involved in these clinical research projects. So overall, what we do at TAOS, we call it a TAOS model. So this model has been the first attempt to try and align language service with other disciplines and departments within a health service. So we firmly believe that language service professionals are not just a bunch of bilingual people, but professionals whose role is fundamental in delivering patient-centered care and shared decision-making. So with the TAOS model, language service professionals become part of a multidisciplinary team consisting doctors, nurses, allied health clinicians, who provide a care package to healthcare consumers. So we strongly believe our mission for the language service in healthcare is not because it is a shame that our patients don't value English language as the national language of Australia, but because we acknowledge here is the language barrier we need to acknowledge. This is preventing our patient with low English proficiency from equitably accessing their healthcare. And as a healthcare provider, we do need to be culturally competent to provide equitable access to everyone, regardless of their ethnicity and their ability to speak English. So that's why TAOS model is so successful in the past 15 years. Can I come to the next slide? Thank you, Tia. So yes, regarding to interpreting service, we do have a very high volume of demand. 20% of our appointments need interpreting service. That is 1 in 5 appointments will need to engage an interpreter to deliver the medical consultation. So that is very high ratio. However, we do think there is still a gap because from the demographic data we're collecting, we think at least 25% of those appointments should have interpreting service. So there's still a gap, we think. To manage such a demand, we have developed our first internal system called Health Power, which was a booking system in 2008 to automatically receive the bookings when a clinical appointment is made for the patient who requires language service. And in 2017, we developed another system. We co-designed it with Prime Access, who is one of the panelists here today. It is called IMS. Now it is also widely used in Australia Health Services. And on top of the pre-booked clinical appointments, we also see around 15% of the demand we are receiving daily. They are coming on the same day, so which means they are not pre-booked. We call them extra bookings on the same day. So they're potentially from inpatients, emergency department, short stay unit department, or any clinical walk-in appointments. So we do see that happening quite often, and there is a tendency of that demand increasing as well. So another thing I want to mention regarding to interpreting is with the improvement of awareness about the necessity of engaging interpreting service, the challenge we are facing now is communication, to be able to cater for those on-demand bookings, to understand the availability of our interpreters at the time when the clinicians really need the service. So for interpreters, we have come to a consensus that we know in a hospital, it is almost impossible to expect everything to go as planned. So we have to be very flexible and adaptive. But the challenge here is always about how to make that happen. So how to make the demand meet the availability in a more flexible way. So that has always been the challenge. Another thing, a huge shift that we have witnessed during the pandemic is the rise of remote interpreting, including telephone and video interpreting. So we always believe face-to-face interpreting is the best mode of delivery. However, remote interpreting does have its benefits in efficiency and access, but video interpreting is definitely a much preferred mode if we need to use remote interpreting. Unfortunately, we haven't seen video interpreting taking off due to a combination of barriers. For example, understanding of video interpreting, staff skill sets, workflow design, technology, as well as communication. So we do need to work on this area much more now that we know the restrictions of COVID within healthcare facilities will probably continue for a long term. So yes, let's go to the third slide. The third slide, I'm going to talk a little bit about the translation service. So in terms of translation, we have witnessed a dramatic increase, as you can see, from the beginning of the pandemic, because it has surfaced, fortunately or unfortunately, there is an information gap between the different CALD communities during the pandemic. So the first thing people would think of is to, yes, okay, let's translate those documents into different languages to convey those crucial messages about COVID into multiple languages, hence the translation search from the beginning of the pandemic. On the other hand, because of the sudden increase of demand and its urgency associated, we very often found ourselves competing, unfortunately, with machine translation. For example, when we are often asked to translate a whole website, asked to translate a newly developed app for the patient in order to convey the message, for example, COVID message. However, when we say, no, you can't use machine translation, you need to use NATI certified translators to do the job, the first question we would get is, how long can you give me the translation back? So yes, we have been thrown into the midst of competing with machine translation in that regard. Very unfortunately, but also fortunately, it works as it's very alarming for our industry. So it goes without saying that machine translation is becoming more popular due to, of course, the stunning advanced AI technology, but it is still way too risky and not practical in health context, simply because a seemingly mild misunderstanding can turn out to be detrimental. And who would you blame when things go wrong? I think there is a much bigger ethical question here if people just want to go ahead and use machine translation for health service. But we shouldn't shy away from technology in a way. Working with technology is something everyone is talking about these days. So, for example, using the CAT tools driven by translation memory definitely helps everyone in terms of productivity and our quality of care, and it benefits largely to our CALD community. That is another area, I think, for health service to work together with language service providers in the near future. That is very crucial as well. So here are the challenges we have experienced when health service meets language service at Northern Health. So I would also love to hear more from other panelists. So back to you, Tia.
Thank you very much. Over to, so just a reminder, again, I can see that the audience is already using the Q&A chat function. So there's a chat function just in terms of housekeeping and the Q&A. So if you have a specific question, which we already have a couple of, then please use the Q&A function. And for chatting with the others, use the chat function. But over to Linda from Barwon Health. Linda, what keeps you up at night? Give us a snapshot from reality at Barwon Health.
Yes,
please.
Hello. So at Barwon Health, we have a lot of call patients, especially a large refugee community in Geelong. So when it comes to, refugees coming in, we need to provide their first care all the way through dental, rehab, outpatient, inpatient, the whole thing. We only have a small in-house interpreter base of currently 5 staff, as we've only had our in-house office for about 12 months now. All our bookings are made through IMS with Steve, and we anything that excludes our in-house interpreters availability or languages, we use agency. We're really grateful that we have the option of using agency. We just seem to struggle at times, obviously, with the reliability and the accessibility, because obviously lots of hospitals are all, needing to access the same agencies for interpreting. So I guess if anyone interpreter-wise is coming to do a booking at Barwon Health, it's a great place to come and it's a great place to be. Our values are really important. So as long as staff are aware, compassion, respect for our patients and staff, it's come to, we all on-site interpreters, even from agency, should be filled to make part of our team. So I guess the main concern is the reliability of interpreters and the availability.
Thank you. Linda, just on that, maybe paint us the picture. Do you have an example, right, where what you see, with interpreters? I mean, what are sort of typical maybe issues, behaviors, or something you see which you would like to see differently?
Yeah, so coming late to an appointment, we get that it's hard to find a hospital at any hospital, to find a car park. If someone just rings and let us know we're running late, everyone understands that. If at the last minute something urgent's come up and you cannot make the appointment, we totally understand. You just need to let us know, but we do find that people just don't arrive without notice, so that leaves the clinician and patient waiting. Sometimes we've had them waiting for an hour as we're trying to locate the interpreter. Also picking up video appointments when they're not in a safe and secure space where they can maintain confidentiality. Again, if you've picked up a booking and you're unable to get home in time, again, just communicating that to us, and we will try and accommodate to make sure that we've given you that extra time that you need to get home, to get in, or in a space where you can do that booking confidentially. So, the appointment can go ahead. But just not picking up work, when you're surrounded by people at the bus or in the park or in the supermarket, it makes it difficult. And then there's makes the appointment with the clinician and the patient not successful, and they're not able to communicate properly.
Yeah, thank you, Linda. And this will be, so you get interpreters taking calls on the bus. So that has happened.
Yeah.
Yeah. So why don't we, for now, bring it to the voice of the interpreter. Despina, maybe over to you for some thoughts. You're a very experienced interpreter, as we heard, in the health sector. What do you hear from interpreters, and from the interpreter side, over to you?
Thank you, Tia, and thanks to the other panelists, to you and Linda, for their input so far. What I have to say from my own perspective as an in-house or hospital interpreter, I have to say that it is very difficult for freelance colleagues, for freelance interpreters, because freelance interpreters are not familiar with the layout of that system, of that hospital or healthcare service. And obviously, they cannot be very familiar with the terminology, the medical terminology, the specific terminology that is used in that setting. because medical terminology is something really broad. So we can't expect from each and every interpreter, certified interpreter, to know it all or understand it all without being repeatedly exposed to that specific terminology. So it has happened, and we have all witnessed, interpreters that are not familiar with names of common procedures or with idiomatic expressions. So what they do is they maintain the English word and give it a twist by pronouncing it with an target language accent or a target language ending, so as to make it a word of that load. But that in doing this, they create words that do not exist, and that can be very dangerous in a health setting. So furthermore, interpreters are often seen by the other professionals as the bilinguals that come and go, freelance interpreters. They usually stay only for the 90 minutes, and it's very difficult for the interpreters and the healthcare staff to build any kind of rapport within this time frame. So it is virtually impossible for the interpreters to be seen as members of the healthcare team that have the same goals and want to achieve the same outcomes, which I maintain it's the way it should be. Interpreters are a vital part of the healthcare team, working alongside with the other healthcare professionals. So to add to that problem, as we know, formal training in interpreting and translation up until recently wasn't compulsory. So it became compulsory with the certification scheme that was introduced only a few years ago. But now we are faced with a situation where we have highly trained and qualified interpreters and other interpreters that didn't have any formal training, but transitioned to the new scheme, to the certification scheme. So we can't expect all these interpreters to have the same understanding of the basics, such as the application of the interpreting code of ethics, what in actual fact means professional conduct and professional boundaries, and all the other principles. So these are things that no one is natural at, but they require formal training and continuous professional development to be enhanced and to be understood. So this is one side of the coin. The other side of the coin that I and other colleagues have come across is that healthcare professionals, doctors, nurses, allied health staff, they don't quite understand the notion of effective communication, because it happens, and especially with established languages in the community. So migrants have been here in Australia for many decades. They have a reasonable command of the English language. They have what's called functional English, but that is never enough to navigate the complexities of a hospital, of a healthcare setting, to understand medical terminology, to understand a diagnosis, a course of treatment, and adhere to a course of treatment. So we should never confuse the two as being the same, having functional, everyday, adequate English ability with the ability to understand what happens in a healthcare system that uses another language other than the load that the patient speaks. So I think these are two important points that need to be brought onto the table.
Thank you, Despina. So this, the agency interpreter, aligning them with a hospital interpreter is something actually that came up several times already in the brainstorming beforehand in our meetings. And yeah, so one of the things we already cited to approach health services, those health services that actually have in-house interpreters, if they allow their in-house interpreters for 1 hour per month, or maybe every 2 months for 1 hour to come onto a webinar, and we bring the freelance interpreters together. What do you think, Despina, of this model? Sorry, I brought you back, Despina, for a second.
Yes.
Could that work?
I personally think this is a brilliant idea, and I would be the first that would, offer such a session, at least for the health service that I work for. I speak from my own accord. I haven't obviously spoken to my colleagues, the other interpreters. We're a small team, but I think it's a great step towards the right direction. We need to provide the agency interpreters with the tools to do the best job and to provide the best possible mediation for the interpreted consultation. So one way is to guide them through, maybe through a virtual tour of how things are done and what an appointment at our healthcare setting entails too. So I would be very interested to progress these thoughts and eventuating these actual, webinars or workshops.
Great, thank you, Despina. So good to see that we have already some tangible ideas. We are going just briefly through to just a few words from Helena, and then we'll hear from technology in NAATI, and then we've got plenty of questions to answer. And already thank you to Steve and Tamas, who see some where you can actually already type the answer. And also a reminder for the health services in the audience today, please don't hesitate to share experience and also put questions. But over to you, Helena, over to you.
Thank you, Tia. And yes, no, I won't take a lot of time. This is just a slide just in terms of the language service provider here and what our role is in many ways. And what we're striving for is, of course, the timely delivery of interpreting services, ensuring that interpreters are available, are arriving on time, and ensuring that that communication is projected. The building trust of the interpreters is actually a really important part of what we do. And that we are consistently looking at ways of improving quality training, induction programs. And of course, since COVID past 2 years, all of these specific different trainings are done virtually now, which is a fantastic tool to gather interpreters from across all parts of Australia. Our risk mitigation is another area that we must always be across and ensure that we utilise our customer care portal to gather all the data and information that we can to prevent any situations. And the last two of continuous improvement is something that we consistently look upon by incorporating technology and upskilling our interpreters, which is all part of the training programs.
Thank you, Helena. And look, these are all basic sort of concepts, and yet they're so important because the upskilling is, I say this for all the language service providers, and again, big hello to the language service providers in the audience today. All of them actually have been doing this. We on our TUM Academy, then their platforms to really not only the technology, but also building the trust, right? And we've heard some of the pain points of protocol, of taking things in a bus, the terminology. So that still remains a really big part, and the timely delivery of interpreting services. But let's go over to technology. Steve, from IMS, where does the technology come in? We sometimes see interpreters, they have their day full of many appointments with different language service providers, right? They're rushing from one appointment. How do they actually book it? Is there a calendar? How does that work from technology? Over to you.
Thanks, Tia. So technology plays a really important role in providing health equity for patients, in the fact that having an interpreter for a patient is vital for them to understand what's going on. So the speed of getting an interpreter to a patient is important. Nowadays, video, as Yue mentioned, is that there are some challenges with video for hospitals, internet connections, things like that. But it is getting better. And so video is great, and you can do it from almost anywhere, hopefully not on a bus. But so what our platform IMS would do is to ensure that the information requested for a patient as the interpreted language required is sourced as fast as possible. So we would have an integration to some patient systems like Epic or Cerner and things like this, IPM. And so as soon as that information says we need an interpreter for a patient, the faster we can get that request out to an agency or LSP, the quicker they can find the interpreter. And as soon as they can find an interpreter, obviously they can secure the interpreter so the patient knows that they're going to have an interpreter for their appointment. So that's vitally important. We have integrations to a lot of agencies. So, for example, TAOS is one of them. That the patient information from IMS would be sent to the agency securely via integration. That allows the agency to find that interpreter more quickly. The other thing is, as mentioned, is interpreters are running around all over the place, maybe multiple appointments on one hospital, or they're moving from one hospital to another hospital to see another patient. And so, a mobile app that lists all of their jobs, they can click on the appointments, click on the link for the address, go to Google Maps, find out where they have to go to next, and ensuring that they can complete the jobs. It's really important for a hospital to know when the job was completed as well. So they would fill in post-booking details of the job and say, I finished here, or the patient failed to arrive, or what time they started and finished, and so forth. So it's really important for the hospital. A question that Patricia Avila has asked in regards to NADI accreditation, that's vitally important. This is why compliance is really important, and IMS is very big on making sure that the interpreters that are servicing patients are NADI certified. And so there's an integration with NADI that IMS will go out and then check the accreditation expiry dates for those interpreters, so that if a booking is after an expiry date, IMS will alert the hospital and say, well, this booking here is potentially non-compliant because the interpreter's certification has expired. Because it happens up every night, it'll update and make sure that it's corrected if it's changed. So accreditation is vitally important. IMS will then let you know if this interpreter is a family member, because sometimes, if you've got thousands of bookings happening every year, 300 a day, you're not going to be able to check if this interpreter is connected to a family member as a patient. So IMS will do that for you, and you can, when you know that information, you can then disconnect that. So if accidentally the interpreter was allocated to a job for a patient that happens to be a family member, then the system would alert the hospital and then deal with it. So yeah, speed of accuracy and of the interpreter, of getting them on and sourcing them quickly, vitally important for a patient.
Yeah, thanks, Steve. Let's move over to Nati, the role of the National Accreditation Authority for Translators and Interpreters, and over to you, Mark Painting.
Thank you very much, Tia, and hello again to everyone. I think it's just important to explain NATI's context in this space, and it's an easy one, a better one. The health sector is a really appropriate one, because what health professionals understand, and anyone working in the health sector, is understand clinical governance and risk. And so what's important about engaging NADI certified professional interpreters, it goes to that clinical governance and quality. And essentially what the NADI certification is a system of quality assurance that gives consumers of interpreting services a level of confidence that the individual, the certified practitioner who's providing a translating or interpreting service, has had a minimum level of training, has been independently assessed or tested, is required to abide by a professional code of conduct and ethics, are current in their work, and of course engage in ongoing professional development. So all of those things are automatically ticked by anyone holding a NADI certification. So from a clinical governance point of view, it makes a whole lot of sense in the health sector. So, it's important that people understand that, as well, obviously interpreters, but also other health professionals and allied health professionals. to understand that, because it gives a level of confidence, and it's why we want to encourage more health professionals and more hospitals and more health services to understand that and specifically request that interpreters provided do hold NAATI certification. While I've got the floor, I should just mention something about the issue around translation and machine translation as well, because often too many people, we often think that it's got to be one or the other, and of course these days it'd be crazy to think that you can just ignore the technology that's emerging and current. And so the issue around machine translation is not one of using a machine instead of certified interpreter, but of course you would use a machine because it's just faster. No different than an accountant using in a spreadsheet, because you can add up numbers much quicker. But if you don't understand the context of what the numbers mean, it's irrelevant. So, of course, you use the technology to help to make things quicker. But a certified translator will also understand that and still has to take responsibility for the end output. So their editing or checking of that is important. So. Yeah, that's I guess the main things I wanted to talk about NAATI, and any other ideas that come from this. As we pointed out, ongoing professional development is really, really important, just like any profession, and it's great to see that there is much more professional development available. And I encourage people to take a really expansive view of professional development requirements, and if in the health sector, if they're learning medical terminology and all of those sorts of things that help them interpret, that's still a really appropriate PD for an interpreter in this space.
Thank you very much, Mark. And while we have you here, just on just one before and then we're going to open up for Q&A. The NAATI, so I can see already in the chat box, and obviously I know the conversations. After all, I'm an interpreter myself. That passionate dialogue you can see about bilingual workers, right, versus interpreters, right? And here we have the interpreters who go, no, you can't use bilingual workers. It's not the same than a certified interpreter. And yet we also hear from health services who often say, well, yes, ideally, they mostly prefer the in-house hospital interpreters, which is normal because they're in the setting every day. They know the terminology, they know the context. But sometimes you hear that they say, well, I'd rather use the bilingual workers. So that is a reality because they know the terminology and the context. Now, of course, we know a bilingual worker is not an interpreter. We're here under professionals. But to you both, Mark and Despina, the specialist health, certification that's coming up. How realistic is it? Because also interpreters, I hear your passion about how important it is to use interpreters and not bilingual medical workers. Yet, are the interpreters prepared to do the work and the effort of going through yet another NAATI and the expense of going through another NAATI certification to get to that higher level? Mark, what do you hear so far about this?
Yeah, thanks, Tia. And so, yes, the introduction of our Certified Specialist Health Interpreter credential is relatively new and only just starting to roll out. It is a very high level credential. It's clearly not going to be available in many languages, probably the top anywhere between 6, 10, 12 maybe as it rolls out. It's whether people want that. One of the challenges, of course, at this stage, at least, there's not a great incentive to do the extra time and effort and study if they're not remunerated appropriately, and that's a separate conversation. But certainly for those languages where it is available and people do want to, what we at least hope is that they are recognised for that specialty and get a lot more work because of it. But even if that is not the case for languages where there's not, there's still various levels of certification, and we encourage the highest level of certification all the time. Of course, a system like we know hundreds and hundreds of languages in Australia, there'll still be some very very languages of low diffusion where certified practitioners won't be available, and the credential of recognised practicing interpreter that is only available in these languages where you can't get a full certification, acknowledges that, but it also puts at least some training in place, and people with that recognised practicing status are still required to engage in ongoing PD, still required to be code of ethics and so forth. So, you know, the certification system tries to acknowledge all of the challenges because we are far from a perfect world. So from all the way up through the strata of certification is still a really important method, and any level of certification still brings with it at least some quality assurance measures.
Thank you. Thanks, Mark. Despina, over to you. What do you hear from the interpreters about this?
Yeah, I would like to take the conversation a little bit before the specializations, the NAATI specializations, and to share a little bit of my experience just by talking with other interpreters. There is a hesitancy in going deeper in terms of formal training when it comes to interpreting and translation already. So there is reluctancy to enroll in postgraduate studies in interpreting and translating, because interpreters, and we can understand this, they do not see an incentive in them placing more effort and finances into becoming more qualified, more knowledgeable, more experts, because that expertise is not then reflected in conditions and remuneration, as Mark also pointed out. So starting from this point, the reluctancy to deepen one's knowledge and expertise in translating and interpreting, we can understand that it will be difficult for the majority of certified interpreters to go for the specializations, the medical specialization, which is the case in point. So it will take maybe a long time and a lot of advocacy from all stakeholders for this to actually go ahead and have these medical specialized interpreters.
Thank you. Thanks, Despina. We've got passionate discussions going on. So I'm going to stop sharing so we bring all the panelists because it's time for your Q&A. And just a reminder as well, if you if you want to subscribe to future webinars, please do hop on that academy@2m.com.au. But for now, I'm going to stop sharing this so you can see everyone, and let's have a look at some of the questions. So we got questions in the Q&A panel, but we also got interesting chats happening with I just want to, Nadia Arash was saying professional development is essential. However, do employers or supervisors have mechanisms in place to monitor implementation of ethical practices, right? I assume, Nadia, you mean in terms of, this is provided if they did the right thing when interpreting in terms of all of the code of conduct, if you take the OSIT code of conduct, for example. Maybe just briefly over to Helena on this, because I believe what you call the interpreters, you check on how, with both sides, how do the interpreting assignments actually go? What's the reality? How does this look like?
Perhaps Tamas, would you like to take on this question?
I'm sorry, Helen, I was reading the chat window. So what was the question, if you can sum it up quickly?
Look, just 1 minute before we go to the other. But the question was like, how do professional development is essential. However, how do employers and supervisors have mechanisms in place to monitor the implementation of ethical practices of the interpreters?
Well, I mean, okay, well, we are not sitting next to the interpreter when they are doing the job. What we rely on is, of course, feedback of the client. So we do have a client portal where, you know, our clients, the hospitals, can log in and they can provide direct feedback, or they can just simply send us an email, pick up the telephone and talk to us and share their experiences. And this is what's been happening with you know, Barwon Health and also with many of other clients. One of my jobs is going through those, analyzing the issues with my team, and, you know, making steps to ensure that those quality issues don't happen again.
Thank you so much. Sorry, Helena, over to you.
Yeah, and of course the inductions, which is something that we work with, and we discuss, I guess, the client's needs and ensuring that that is across, put across to our interpreters.
Exactly. I mean, it's best to prevent. Take preventative steps via induction and training.
Yeah.
Yep.
Thank you. It was a really great question, Nadia. That's why from all of the questions, this is the one I pointed out. How do you know, because there's interpreters who go and do, right, the contact. We do know there's a lot of interpreters who don't. We do know that. And is this being called out? Do people know this, right? Is there a feedback loop? We've got Yue has raised their hand. So over to you, Yue, please.
Yeah, I also would like to answer that question. I think when we talk about the quality of our service, when we are talking about ethical concerns, we always have to look into the numbers. So we can't put things if we can't put things into context. We can't say overall all the interpreters are not professional. We can't just have that statement without any investigation. So, for example, we do have 300 bookings per day, but if we talk about the number of complaints, we probably wouldn't have a single one for a month. So I do believe the majority of our interpreters are highly professional, and no one would turn out to work saying, I just decided to pose some risk to the patient care today. I just make that decision and I want to make that happen. No one does that. So there's always a barrier there, and we need to, that's why it is fantastic today everyone is sitting together. We need to communicate and investigate what are the barriers and what's preventing us from keeping that communication flow to what are the things we need to do. So for example, me and Linda and a few of other hospital language service managers, we recently are discussing about not having enough on-site interpreters coming to our on-site jobs. So one of the reasons is because some of them, they haven't had their third booster for the vaccination, so they cannot attend on-site appointments. And another reason that we found out is a lot of the staff, the agency interpreters, they haven't been properly trained for how to wear their PPE. They haven't been fit tested. They don't know the procedure. So we do see there's a gap between the in-house interpreters and the agency interpreters. So what we can do about it, I think we all need to think about that. We already have some preliminary ideas about it, which is great. And what about we take a step further? So in Northern Health, for example, we incorporated the agency interpreters check-in process into our queuing system, which is the outpatient queuing system, QFlow. So by doing that, we encourage the agency interpreters as well as in-house interpreters to check in from the kiosk, so they receive a text message when the patient is ready to be seen. So by doing that, we do lift up the profile of the agency interpreters. We do consider them as part of our workflow. So on the other hand, how do interpreters see ourselves? So do we look after, so do we take the same level of sensitivity to our patient information? Do we strive to best practice all the time? So that is all the questions that I think interpreters need to think about as well, because after all the transcultural training to the clinicians saying that we can't use family members, our professional NATI certified interpreters, they're excellent. We assure you that we will be able to provide provide a seamless communication between you and the patient. And after that, I think the least thing we want to hear is a complaint about an interpreter being unethical, omitting the information or providing extra advice to the patient, which has been picked up by the clinician. So I think that is the saddest moment when these kind of things happen, because I think everyone is trying to do our best to provide the healthcare to the best of our ability. So yes, I think that's all I want to say. Thank you.
Thank you, Yue. And look, I hope, I mean, we will run a little bit over time, because this is just too passionate on the questions. I just want to point out also for the hundreds who are going to listen to this without seeing the chat box. The chat box, I'm sure many of you are following it. One of the biggest hospitals in Perth said, this is from Nora Pucci, to me, they don't have time to give feedback to the agencies because the interpreters, about the interpreters. No news is good news. I mean, feedback is important, right? All the health services in the audience, everybody, language service providers, the interpreters need feedback. I hope your language service provider, I mean, we have a customer care portal, for example, make it very easy in a few seconds to submit incident register feedback on, because you know, we can hear a few points from this chat from a Tasmanian health service perspective. We hear, this is Seth. We provide education to our staff around the use of interpreters, the role of an interpreter, how they should be treated. So we encourage staff and interpreters to reiterate the interpreter's role. So, you know, so we are going to pull many of these comments. So thank you very much, and put them in a post, and you will get them for those, you know, because there's a lot of intelligence gathered here, and just so many valuable hints and questions, which really show that we have to, you know, this is only the first one. We will have more. But just on the question, the Q&A question, because there were some for, just for some, the first one, Yue, Diane had said, was the 20% of clinical appointments you mentioned in the very beginning needing interpreter services? Okay, Australia-wise, I'm sure you have understood by now, or did that relate to a specific area? It's Northern Health, so could you just tell the interpreters just briefly what the area of Northern Health is, because some thought this was the Northern Territory.
Yes, Northern Health is, sorry, the very good question. Yeah, so Northern Health is based in Melbourne. Our catchment is the northern area of Melbourne. So we cover the city of Whittlesea, the city of Hume, part of the city of Darebin, and part of the city of Moreland. So we also cover the northern region of all the way to Kilmore. So we do cover a very large catchment. Yeah.
Thank you. Another one was actually also, I know that this is very interesting for the funding. Somebody wants to know, do you use the funding from Victoria Health? Where does the funding come from? This is for you, Yue, as well. This is for Northern Health. And how can you have in-house hospital interpreters? And why do you have funding for hospital interpreters and others don't?
Okay, so that is a very tricky question. Yeah, so in regards to the funding, I think all hospitals have certain funding for language services. So some hospitals decided to go to the agency mode, and I think more and more in hospitals in Melbourne, they've taken upon the TAOS model. They are employing more and more in-house interpreters to cover their demand. So I have to say, by having in-house interpreters, we do have the benefits comparing to agency interpreters that Despina already mentioned, the familiarity that we have with the context, as well as the familiarity that we have with the clinicians and the appointment. Sometimes our interpreters have known their patient for years if they're constantly coming to our health service. So by telling the organization that having an in-house model benefit the healthcare and the health outcome of our catchment definitely will help getting the funding for a larger in-house workforce.
Thank you very much, Yue. And just for some of the questions, the whole topic machine translation post-editing is something we deal with here at the TUM Academy regularly. So please make sure you subscribe so you get them, or simply register and look at some of the other machine translation webinars that have been done. There is, obviously no time now, but it's something we're busy with regularly. So and lots to say about machine translation. And as Mark said, and Mark, I was expecting you to bring out the calculator that I usually like to bring out, but you went on to spreadsheets. So yeah, so good to see this. Briefly, also interpreters are asking if they can claim PD, points. Yeah,
absolutely.
How is that? Yep. So and you will get everybody who's interpreters, you will get the evidence for that. So we are running out of time. I really want to take the opportunity to say that this is only the beginning, right? We will have more of these webinars. It is important. So it's not like we are presenting, well, thank you, Yue, for your presentation. And thank you, Linda, for coming in and showing us. It's important that interpreters, that language services sees the face. Here's what keeps you up at night, what you want. Also, interpreters have a lot of, there's a lot to worry for us, for interpreters, but so is there for everyone, for language service providers, for technology, for the standards body, right? So it's very important that we also take some of our preconceptions, and throw them out of the window and really listen to someone else on the table and see, right, so what are the takeaways, right? I think we can learn, we interpreters, we can learn from hospital interpreters. We also heard, and thanks Patricia, I saw that, we can also learn from bilingual workers. So those bilingual workers, some of us interpreters, think they're almost our competition because they're being used as interpreters and not even NATI certified. Make sure we get together and everybody learns from themselves, because just because you are NATI certified and ideally an OSIT member adhering to the OSIT code of conduct, that makes you a professional interpreter without any doubt. But does not automatically make you a professional, experienced medical interpreter, right? It's a different step. So yes, we are here. So I also encourage interpreters to at least consider, investing in themselves, investing. And I think, John, thanks also for your comments. It's not only one medical training. It can be birth, it can be death, palliative care. That's a whole spectrum but health is important. Many of you and us, I'm an interpreter myself, so is Tamash. Here, we are working in health settings because such an important setting. So it's important, and the budget is an issue, of course. There are partly, as you can see in Queensland at the moment, there's the Interpreter Training Boost program for certain languages, right? That is running over the next 3 years, where the government actually provided some funding for training with NATI, testing at the end. Maybe, Mark, this is something I've heard from interpreters as well. Is there more? Is there anything more that, if it's, somebody said in the chat box, if it is so important to you to have, medical trained interpreter, how come there's no funding, to train us? Do you, just as maybe a last comment, do you know anything? Is there anything in the pipeline on anybody we could lobby for this?
I do know that one of the government service providers has got a bit of at least aware that one government service provider is developing some sort of funding program for some training for specializations next year. That's the only one I'm aware of, and we do hope that more service providers also become part of the solution in some of the PD opportunities that are available, because at least there are a lot more opportunities with online training now that that could be done. So yeah, I understand that it is difficult to chicken and egg, because you have to pay to get the more training and development before you can get the specialists that we hope will then get paid more.
Thank you, Mark. And really, it's great to hear that from the other government language service provider. Again, this is about, we all have to, everybody, all language service providers together. This is a plug for the Australasian Association of Language Companies, where actually the language service providers work together for better outcomes. It's a plug for AUSIT, the Australian Institute of Interpreters and Translators. If I was, as an interpreter, I have to say I am, not only the CEO of TUM Language Services, I have been an AUSIT member for 22 years, right? This is, always go to your professional association, so investing, but thank you to the panelists first for taking your time and so generously sharing. We hope to have you back here. Thank you for that audience, that passionate audience. We still have way over time, over 224 live hanging out there on your lips. We've got great feedback. Thank you all for your kind words in the chat box. So please, for those interpreters who are not yet, registered with us, please don't hesitate to hop, on academy.2m.com.au and register your interest, so you will receive future notification alerts as well, and all the health services who are here. That's it from us. Good evening to all of you. There are some internationals here, so good morning for you. And a big thank you again to our health services, standards provider NATI, of course, technology, Steve Hooper, our own Helena and Tomasz, and Despina, the voice of the interpreter. See you next time. Thank you.